Have you ever taken your socks off at the end of the day and there's a deep line around your ankle? Or you press your shin and think, why is my leg holding on to that dent? Maybe your shoes feel tighter, your ankles look normal in the morning, but by 5 or 6 o'clock, they look completely different. And maybe you already have high blood pressure, so somebody tells you, oh, that's just your blood pressure. I want you to understand something today. Don't just try to drain the fluid. Decode why the fluid is there. Because swollen ankles and legs are not a disease by themselves. So the medical word for this swelling is edema, which is a fluid accumulation in the tissues. Too much sodium can contribute, but swelling can also be related to circulation, medications, kidney problems, heart problems, liver problems, lymphatic problems, and other conditions. And here's another important distinction. High blood pressure does not automatically explain swollen legs. Sometimes the same thing contributing to your high blood pressure is also contributing to the swelling. So sometimes long-standing high blood pressure has affected the heart or the kidneys. And sometimes, now watch this, the medicine you're taking for blood pressure can be contributing to the ankle swelling. Amlodipine and other calcium channel blockers, for example, can cause swelling of the feet, ankles, or lower legs. That does not mean to stop your medicine. It means it's worth having a conversation with your provider. So, today I'm going to teach you why fluid collects down there, how your food may be affecting it, and what you can do naturally to support better circulation and fluid balance. And most importantly, how to recognize the swelling you should not try to treat at home. So, let's make this incredibly simple. Imagine your circulatory system like plumbing in your house, okay? Your heart sends out blood, but blood also has to come back. And getting blood back from your feet all the way back to your heart means you're fighting gravity. Luckily, God gave you a little helper down in your legs called your calf muscles. Every time you pump your legs or walk, those calf muscles contract and squeeze blood through the veins and back upward. That's why I sometimes call your calves your second pump. Now, imagine sitting at a desk for 6 hours, or sitting in a recliner watching television, or driving all day. Those calf muscles, they're not doing much, right? Gravity wins. Fluid starts accumulating. That's why movement and leg exercise can help pump fluid from the legs back toward the heart. Now, add a second issue, sodium, salt. Salt helps regulate fluid in your body. But when you're consistently getting too much salt, the body can retain more water. So the American Heart Association recommends no more than 2,300 milligrams of sodium daily, with an optimal target of around 1,500 milligrams for most adults, particularly people dealing with high blood pressure. But here's where most people get fooled. They tell me, but Joel, I don't put salt on my food. I didn't ask about your salt shaker. I asked about your sodium, your salt, because sodium is hiding everywhere. Restaurant food, lunch meat, canned soups, frozen dinners, seasoning packets, bottled sauces, salad dressing, fast food, chips, cheese, processed meats, even some foods that don't taste particularly salty. So somebody can put almost no salt on their plate from the salt shaker and can be consuming a high sodium diet. But before we talk about the remedies, I want you to become a detective. When somebody tells me my legs are swollen, I want more information. Question one, is it one leg or is it both legs? That matters. Both ankles swelling after sitting all day is very different from waking up with one leg swollen, painful, warm, or red. A blood clot, or called a DVT, can cause swelling, pain, or tenderness, warmth and redness or discoloration, but it's usually in one leg. A DVT requires prompt medical evaluation. And if leg swelling is accompanied by sudden shortness of breath, chest pain, coughing, blood, fainting, or difficulty breathing, that's an emergency territory. Those can be symptoms of a pulmonary embolism. So please don't watch a video about dandelion tea while you're having symptoms of a blood clot. That's not a time for natural remedies. That's the time for the hospital. So question number two is, did the swelling come on suddenly? New, unexplained, or rapidly worsening swelling deserves investigation. And question number three is it worse at night or better after sleeping? That can give your clinician clues about circulation and gravity-related pooling. And question four, are you short of breath? This one matters because swelling in the feet, ankles, and legs can occur when heart failure causes fluid to accumulate. Heart failure can also cause shortness of breath and rapid increases in body weight from retained fluid. So, then final question, what changed? Did you start a new medication? Did your medication dose increase? Have you been eating a lot more restaurant food this week? Did you travel? Have you been sitting more? Did the swelling start after an illness? These types of questions. That's the difference between randomly treating a symptom and looking for the trigger. And you know, after listening to me, I'm always talking about the cause. Find the cause. These are the kinds of questions you always need to be asking yourself as you deal with what's wrong with you. So, here we go. This section surprises people. Sometimes somebody has swelling and thinks, I need something natural to get this water off. But first I want to know, what are you already taking? Amlodipine can contribute to ankle and lower leg swelling. NSAIDs, or pain relievers such as Tylenol and naproxen, can also contribute to sodium and fluid retention and can become particularly important to discuss in people with hypertension, kidney problems, or heart failure. So instead of immediately adding another supplement, take your entire medication and supplement list to your doctor or pharmacist and say, could anything I'm taking be contributing to this swelling? Don't stop prescription blood pressure medications on your own, and don't double your water pill. Don't start taking someone else's water pill. And don't assume that because something says natural diuretic on TikTok, that it's safe for your kidneys, your potassium, or your blood pressure. Natural doesn't always mean interaction free. Now, let's get to what you came for. If serious causes have been ruled out and you're dealing with the kind of swelling that your clinician says can be managed conservatively, here are some simple strategies, okay? Number one, find the salt that you aren't tasting. For the next 3 days, don't change anything yet. Just look. Read labels, look at one number, sodium. Start discovering where your sodium is coming from. You may discover that your breakfast sausage, lunch meat, canned soup, seasoning blend, and restaurant dinner are all contributing before you ever even touch the salt shaker. And here's one of my favorite tricks. Stop asking, is this food healthy? Ask, how much sodium is in the amount I'm actually eating? Because the serving size might say 600 milligrams, but if you're eating 2 servings, that's 1200 milligrams. Do that several times throughout the day and it adds up pretty quickly. For people with high blood pressure, DASH style eating with reduced sodium has strong evidence for lowering blood pressure. The NHLBI dash pattern emphasizes fruits, vegetables, whole grains, beans, nuts, lean proteins, and lower sodium foods. Tip number 2, get your calf pump working. Here's something that's completely free. You stand up, you walk, your legs were designed to move. If you sit for long periods, get up every so often and move around. Even when you're sitting, do this one with me. Keep your toes down, lift your heels, lift your toes, down, up, down, up. Now, keep your heels down and lift your toes. You are contracting those lower leg muscles. The CDC specifically recommends moving during prolonged sitting and using heel raises or toe raises and leg muscle contractions to keep the legs active. You don't need a $4,000 treadmill. You need to stop letting your calf muscles sleep all day. One of the simplest habits I would love for you to develop is don't sit for hours without moving. Take little movement snacks throughout the day. 5 minutes here, a walk to the mailbox, walk after dinner, walk after lunch, stand during a phone call. Those little movements add up and keep those calf muscles pumping the fluid back to your heart. Now, you remember how gravity was pulling fluid downward? Here's tip number 3. Use gravity the other way. When appropriate, lay down and elevate your legs so they are above the level of your heart. Not sitting in a chair with your feet 6 inches off the floor. I'm talking about actually giving that fluid an easier pathway back to the heart. Leg elevation is one of the standard conservative measures recommended for uncomplicated lower leg swelling. Make it part of your evening routine. Elevate, relax, let your legs unload. Tip number 4, compression stockings. These can gently squeeze the lower legs and help blood move upward rather than pooling around your ankles. They're commonly used for venous problems and leg swelling. But here's where I don't want you playing doctor. There's different types of compression strengths, and there's different reasons for swelling. If you get unexplained swelling, circulation disease, wounds, significant pain, or other vascular problems, get guidance before deciding that stronger compression must be better. Once you've been told compression is appropriate for you, here's another trick. Put them on before the legs are already huge. Swelling is generally lowest earlier in the day, which is why compression stockings are often put on first thing in the morning. All right, tip number 5. The DASH diet naturally contains potassium-rich foods, things like bananas, beans, leafy green vegetables, potatoes, avocado, oranges, melons, tomatoes. Potassium can help counter some of that sodium effect on blood pressure. And the DASH diet intentionally emphasizes potassium-rich foods. But this is where individual health matters. If you have kidney disease or take medications that affect potassium, aggressively increasing potassium, especially through supplements or potassium-based salt substitutes, can be dangerous. So I'm not telling everybody watching me, go buy potassium. Absolutely not. Food first. And if you've got kidney disease or medications that affect potassium, ask your clinician what your target should be. All right, and number 6, track the pattern. You cannot change what you don't notice. For 7 days, write down 4 things: morning blood pressure, morning body weight, what you ate, especially restaurant and processed foods, and how swollen your ankles are by evening. Now look for patterns. Like this. Interesting. Every Monday after our Sunday restaurant meal, I'm up 2 pounds and my ankles are tighter. That's information. Or, interesting. The swelling started 2 weeks after my medication changed. Information. Or, interesting. I'm much worse on the days I sit for 8 hours. That's information. For people already diagnosed with heart failure, sudden weight gain can be an important warning sign of fluid retention. The American Heart Association advises patients to know the weight change threshold their own medical team wants them to report. We're not obsessing over the scale, we're looking at patterns. Now, let's talk natural remedies because I know somebody's waiting for me to say, okay, Joel, what tea do I drink? There are herbs being marked all over the internet as natural water pills. So things like lemongrass, like hawthorn berry, like hibiscus, like parsley, dandelion, all kinds of formulas. But here's my issue. If you haven't figured out why you're retaining fluid, simply trying to make you urinate more is not necessarily solving the problem. And it could make things worse, technically. So, my first natural prescription isn't an herb. My first natural strategy is removing the things creating the problem. Movement, lower sodium, elevate your legs, improve your food, review your medications, control the blood pressure, figure out the root cause. Now, like I said, there are some herbs that have evidence for helping blood pressure and swelling. Hibiscus, also called roselle, is one example. Research suggests that it has a modest blood pressure lowering effect in some people. It supports your blood pressure and helps support your leg edema problem. These are just one or two of the things that help. So here's what I want you to do for the next 7 days. Not 47 supplements, not some crazy cleanse, not starving yourself. I want you to become a detective. For 7 days, look at the sodium, move those calves, elevate your legs, use compression socks if your healthcare professional has said it's appropriate, eat more whole foods, be sensible about your hydration, track your blood pressure, your weight, and your swelling pattern, and review your medications and supplements with your provider. Because here's what I want you to remember from this entire class. Swelling is information. Your body is telling you that something about fluid movement, circulation, sodium balance, medication effects, and or organ dysfunction deserves attention. Don't panic, but don't ignore it either. Especially don't cover up an important symptom with random herbal diuretics without understanding what's happening underneath. If one leg becomes suddenly swollen, warm, painful, discolored, get evaluated promptly for a potential blood clot. If you're having chest pain, sudden shortness of breath, coughing, fainting, severe difficulty breathing, seek medical emergency care. And if both legs are progressively swelling along with worsening shortness of breath or unexplained weight gain, that deserves medical attention as well. But for a lot of people, there's also very basic things that we've forgotten. Our bodies just weren't designed to sit all day, and our food wasn't supposed to come with 1,500 milligrams of sodium in one box. And symptoms weren't meant to simply be silenced without asking why they're happening. So tonight, don't just look down at your swollen ankles and say, there go my legs again. Ask, what are my legs trying to tell me? Because once you understand the message, you can start changing the things that created it. That's how we move beyond chasing numbers and symptoms and start understanding the body as a whole. Remember, genetics writes the recipe, but lifestyle bakes the cake.